Greetings! My name is Avita, and my group will be presenting our Counterpoint presentation on the sugar-sweetened beverage tax. This is our agenda. We will start off by providing some background information and then going into health-related problems that need to be addressed in the United States. And then we're going to talk about how the sugar-sweetened beverage tax could potentially combat these problems. And then we are going to summarize our final thoughts and provide a conclusion. So to start off, I wanted to introduce by providing some definitions of some terms that will be used throughout our presentation. The sugar-sweetened beverage tax is generally considered to be a per ounce excise tax on sugar-sweetened beverages. It's also considered a soda tax or just sugar tax, and it aims to provide financial incentive to consumers choosing healthier beverages while also increasing revenue for public programs. And sugar-sweetened beverages are defined by the CDC as liquids that are sweetened with various forms of added sugars, such as brown sugar, high fructose corn syrup, fructose, glucose, maltose, etc. They're one of the leading sources of added sugars in the American diet, and some examples include sodas, sports drinks, energy drinks, fruit drinks, and coffee and tea beverages that are sweetened with added sugars. The prevalence throughout the United States varies by state. This is just a map that's color-coded to show what percentage of people within that state consume sugar-sweetened beverages. As you can see, Illinois is somewhere in the middle, but overall in the US, 63% of adults consume one or more sugar-sweetened beverages on a daily basis. And I also wanted to give some context on factors that affect sugar-sweetened beverage consumption in the US, including attitudes and health behaviors, environmental factors, and social structures, along with just other PSE factors, as we discussed in class. So attitudes and health behaviors, there was a survey that was done by California, just the state health survey, that got a lot of this information from their population. And they found that adolescents who know how to select healthy options consume a third of a serving less of sugar-sweetened beverages compared to ones that don't. And the adolescents that felt guilty or they felt like they were being unhealthy by consuming unsweetened beverages consumed half of a serving less than their peers that didn't. And then in a different study by Block and others, they found that the most important factors among college students for choosing beverages were taste and price, which would be affected if a sugar tax was implemented. And then in terms of adults, those who smoke are more likely to consume sugar-sweetened beverages, and adults who spend more time watching TV and advertisements are also more likely to consume more sugar-sweetened beverages than those that don't. So when it comes to the environment, we can think of school, work, restaurants, and we also have some social settings like celebrations and events. Starting off with school, again, the same California study found that grade school teachers often use sugar-sweetened beverages as treats in class, which can lead to an increase in consumption among grade school children. And adolescents that have a store at their university or school that sells high kilocalorie, low nutrient beverages report consuming a third of a serving higher of sugar-sweetened beverages than students that don't have access to those stores. At work, adults that responded to the survey reported having vending machines at their work site, and that basically made them drink more sugar-sweetened beverages in comparison to adults that do not have those vending machines or that just work at home. And then in the home setting, teens and adults that had TVs in their rooms consumed more sugar-sweetened beverages than those without. And exposure to advertising had an impact as well. It was related to 3/5 of the consumption consumed by adults and half of the sugar-sweetened beverage consumption consumed by children. Adults with families that came from like a restriction on how often fast food was consumed also drank less sugar-sweetened beverages than families that never put a restriction on that. And then other factors could include restaurants. Dining at fast food restaurants was positively correlated with an increase in sugar-sweetened beverage consumption, and U.S. households in general purchased a significant amount of their sugar-sweetened beverages from chain restaurants. And then we can also think of some social structures such as celebrations and events. These are often known to have sugar-sweetened beverage options and can lead to overconsumption of them. So why implement a sugar tax? Sugar-sweetened beverage taxes were implemented as an attempt to decrease the consumption of sugar-sweetened beverages in the United States. They also aim to discourage the purchase of soda by making the choice to consume it cost both to the consumer along with other people. One of the long-term outcomes was to decrease the prevalence of a poor diet and obesity, along with the related socioeconomic costs in the United States. And then, furthermore, they wanted to use the money from those sugar taxes and redistribute it. So the government wanted to increase revenues to fund public services and goods using the tax revenue, and this could benefit lower income communities. Another goal was that since it would cost more for the companies to sell the sugar-sweetened beverages, this could incentivize companies to reformulate their products. So based on our research, we crafted a thesis statement that will be elaborated on during our presentation, and ours was that sugar-sweetened beverage taxes may be a means to promote improved population health through lower added sugar intake. So sugar-sweetened beverage taxes are already being implemented in the US in 7 cities. As you can see, a lot of them are in California. And California, as you can see in this timeline, was the first state to ever implement a local sugar-sweetened beverage tax. And the tax rates are in cents per ounce. In California, it started off as 1 cent per ounce and remained as so. Philadelphia does 1.5, Seattle does 1.75, and in Boulder, Colorado, they have the highest sugar tax with a tax of 2 cents per ounce of sugar-sweetened beverage sold. So Berkeley, California was where the sugar-sweetened beverage tax was first implemented, and this occurred in March of 2015, but prior to that, local campaigns and just people in the community had been advocating for this tax for months. Volunteers would go door to door informing how 40% of children will be diagnosed with diabetes during their lifetime, and this is associated with sugar-sweetened beverage consumption. And then once this tax was implemented, the consumption of sugar-sweetened beverages decreased by half within the next 3 years, while water intake increased by 30%. The revenue funds were used for nutrition education programs in schools and in the community, such as the Ecology Center and the Healthy Black Families program. According to Krieger et al. In a 2021 study that looked into the allocation of revenues in the sugar-sweetened beverage tax implementing cities, on average across the years tax has been implemented, $133.9 million were made, and analysis was done on where these revenues were being spent. In that year that the study focused on, $133.2 million were made in revenue. 67% of those revenues went into human and community capital investments, 28% went into health-related investments, and 85% of the aggregated revenues were used to support communities with health inequities. Furthermore, these investments might also result in additional health benefits, according to this study, along with just helping to decrease sugar-sweetened beverage consumption in the population. So I discussed some reasons that the sugar tax was originally implemented, but since its implementation, it has received some support from professional organizations as well. In 2019, the American Academy of Pediatrics, along with the American Heart Association, officially endorsed these taxes as an effective policy to reduce the risks of childhood obesity, and the World Health Organization cited excise taxes as a health policy to employ to improve the health impact of sugary drinks. So lastly, some diseases associated with sugar-sweetened beverage intakes. We have heart disease, obesity, type 2 diabetes, tooth decay and caries, gout, along with non-alcoholic liver disease and kidney disease. Our presentation will be focusing on the problems in terms of obesity, type 2 diabetes, and tooth decay and caries, and we'll also be relating these to the college student population, and Mark is going to be discussing those diseases.
I'm going to talk about a, a bunch of interrelated topics that relate to a potential sugar sweetened beverage tax. There are multiple things at play here that all appear to be interrelated when you look at the research. And by this, I mean chronic disease and their underlying causes, or at least some of their underlying causes. So the first one I want to point out in terms of underlying causes of chronic disease is obesity. There is no question that obesity is becoming a greater and greater problem, not only in this country, but it's growing worldwide too, as other countries start to adopt some of our poor eating habits. And if you look at some of the statistics on the slide here, you can see that obesity worldwide has about tripled since 1975. So in my lifetime, obesity has tripled according to the World Health Organization. We have about 39% of adults being overweight, about 13% being obese. Again, these are World Health Organization statistics, so we're looking at a lot of global statistics, but here in the United States, we are right here at the epicenter of this problem. When you consider that obesity is such a worldwide and even more local problem, and appears to be a underlying cause of some of our chronic diseases, there appears to be a strong correlation between the overconsumption of sugar and obesity. Of course, it's not the only factor, but it's certainly one of the factors, right? And obviously, portion sizes, calorie intake, things like that are issues. But the purpose of this presentation in particular is to look at one of the issues, which is overconsumption of sugar. And there are plenty of studies that can link sugar intake and obesity. One of the chronic diseases that can be most easily sort of connected with the over intake of sugars, and in particular simple sugars, added sugars, free sugars that are not sort of hiding amongst the trees in a high fiber food like fruit or something like that, is type 2 diabetes. And when you eat these high sugar snacks or drink these high sugar, sugar sweetened beverages, you create these big glucose spikes, which is responded to by your body with a huge insulin spike. And over time, the cells of your body that are supposed to be listening to that insulin signal, they start to downregulate their receptors, and they start to pull those receptors out of their cell membranes. And before you know it, you have a situation where your cells are no longer listening to the insulin signal. And it's the insulin signal that is supposed to help you pull sugar out of your bloodstream and into your cells. And when that system stops working, okay, you have a type 2 diabetes situation. And not only is type 2 diabetes itself a chronic disease, it also can cause other related sort of secondary diseases like heart disease and renal disease and diabetic neuropathy. It has been shown to increase your chances for Alzheimer's as well. And if we look at the data for type 2 diabetes, it looks a whole lot like the data for obesity. It is definitely on the rise. It is definitely getting worse all over the world, including our own country, which, like obesity, we're kind of an epicenter for type 2 diabetes. And by 2030, according to the World Health Organization, there's going to be an estimated 1.7 trillion dollars spent worldwide, and about 900 billion in some of these upper income countries like ourselves, on diseases that either are type 2 diabetes or relate to type 2 diabetes. So there is no question that we have a clear obesity issue globally and locally. We have a clear type 2 diabetes issue globally and locally. Those two are certainly related, and connecting the two of them together, at least partially, is the intake of sugars. So the picture that is forming here is that we have an obesity problem. We have a related type 2 diabetes problem. And what we are saying in this presentation is a lot of this is at least in part due to the fact that we have a sugar intake problem. There is plenty of research that connects sugar intake and type 2 diabetes risk. There is even research that sugar intake affects inflammation. And it's well researched and often and well thought about that inflammation is an underlying cause for many things, including cardiovascular disease, including multiple cancers, including pancreatic cancer, and even adult onset insulin-dependent, diabetes. Chronic inflammation of the pancreas can make it stop producing insulin in some cases. And so there's a whole sort of list of things here, both chronic disease and underlying factors, that all appear to be sort of related, and the thing that is researched back as to being a major culprit is the intake of sugar. These connections between added sugars and some of these chronic diseases, as well as the underlying factors like inflammation and insulin, insensitivity and things like that, this isn't new, right? This problem's on the radar of nutrition professionals. The World Health Organization has recommended that no more than 10% of your total energy intake come from free sugars. And this doesn't just include added sugars, which is mainly the target of this particular presentation. This includes natural sugars too, right? So that doesn't leave a whole lot of room for ingesting a beverage that is just absolutely loaded with sugars. And a lot of times people don't even realize the amount of sugar that is in these beverages. So the main target of this particular presentation is sugar sweetened beverages. And one of the reasons why we picked these as a target against sugar intake is, in a lot of cases, these beverages have the amounts of sugar that the person doesn't even realize they are ingesting. They're sort of like hidden sugars. The beverage may not even taste extra sweet to the person, yet when they find out that there could be 60 grams of sugar in this little drink that they bought, they can be way over their recommended intake of sugar just by ingesting the one drink. And another reason why we targeted these sugar sweetened beverages is more and more research coming out that it is in fact added sugars more so than natural sugars that are naturally present within something, that are the cause of this inflammation and type 2 diabetes and the resulting chronic diseases. So we feel that targeting sugar sweetened beverages is a way to really specifically target sort of a hidden source of added sugars. As you can see from this picture here, and this is maybe one you've seen or you've probably seen something similar to it, just the amount of sugar, those things to the right there are sugar cubes. And they don't even look like they would even fit into that Coca-Cola bottle, yet that is the amount of sugar that is in that Coca-Cola bottle. That is way over the amount of sugar that a person really should be ingesting in an entire day, let alone just with one drink that you might consume within a few minutes. So what are some ways that we can target these added sugars in particular, and in particular the ones in sugar sweetened beverages, and how heavy handed do we want to be? How heavily do we want to tax if we in fact do want to tax? There's a lot of questions here. And the most heavy handed approach would be just to prevent sugar sweetened beverage sales anywhere in the country anyway. And that is probably unrealistic, right? They haven't yet completely banned tobacco or other things like that. They're legalizing things more than they're sort of illegalizing things. But maybe they start with government funded locations as opposed to trying to do it everywhere. If you are going to sell them, okay, more realistically, then we tax them. Do you tax the companies that sell them? Right? Do we tax, kind of like taxing the tobacco company? Do we tax Coca-Cola or these companies that sell these sugar sweetened beverages and make a lot of profits on that? Or do we tax the consumer? Possibly the answer is both. What we are targeting in this particular presentation is a sugar sweetened beverage tax. But then there's questions that have to be asked about it. How much of a tax would be effective? If I'm a avid Coca-Cola drinker, is my Coca-Cola going up 12 cents in price going to stop me from drinking it? Probably not. But then how much is too much, right? At what point are you price gouging? And at what point are you digging too deeply into the pockets of the consumers? These are questions that need to be asked. And despite these questions, we do believe that sugar taxes can be part of a broader legislation to decrease sugar consumption in populations. We do think it can help deter at least some sugar sweetened beverage intake. It wouldn't stop everybody, but it may deter some people. It may, if we dig into the company's pockets, which is a little bit an aside from specifically what we are targeting in this presentation, maybe they are less likely to sell these beverages. The money that is taken from these taxes perhaps can be used to educate people. If you educate these people and understand and have them understand, exactly what they're doing to themselves when they drink something like this, that in itself might be a reason to tax. It's just so we can then use that money, that funding, to create these ad campaigns that let you know that these things are really bad for you. Okay, exactly how that would look? Well, do we not allow sugar sweetened beverages to be underneath SNAP or WIC benefits? Do we mandate locations like grocery stores to put their sugar sweetened beverages, if they are going to sell them, on a lower shelf? There's a lot of strategy behind how grocery shelves are stocked, and maybe that could be part of it. But we believe that sugar sweetened beverage tax is at least part of a solution for what is clearly a growing epidemic.
Okay, so now we will talk about an example of a failed sweetened beverage tax. The Cook County Board of Commissioners passed the Cook County Sweetened Beverage Tax Ordinance in November of 2016, which put a 1% tax for every fluid ounce on all sweetened beverages. I will go into more detail about this example by giving you some details about this ordinance. The person that's responsible for paying this tax is the consumers that buy the sugar sweetened beverages, and the money basically goes from the consumer to the retailer to the product distributor, and then the distributor remits the funds to the Department of Revenue. Both the distributor and the retailer are responsible for keeping track of the sales reports, and if the retailer finds themselves in any money that hasn't been taxed for the beverages, they're responsible for reporting that amount to the Department of Revenue. If either don't comply with these laws, they face a fine of $1,000 on their first offense, and for their second offense and each offense after that, a fine of $2,000 per offense. Since we've given you some examples of sugar sweetened beverages, let's talk about some examples of beverages that are exempt from the sweetened beverage tax. The first would be 100% natural fruit or vegetable juice with no added sweeteners, milk, soy, rice, or similar milk substitutes, unsweetened beverages, infant formula, beverages used for medical care, weight reduction or therapeutic nutritional meal replacements, or any syrup or powder sold on its own outside of a beverage. There were several reasons that the Cook County sweetened beverage tax failed, some being legal challenges, implication issues, battles between the soda industry and the public health groups, and general public disapproval and protest. Not only was Illinois sued by the Illinois Retail Merchants Association, but also there was a huge battle between the American Beverage Association and the American Heart Association. That did not improve the existing issues happening in Cook County before the tax was implemented. Cook County, which is a county with 5.2 million people, was experiencing budgetary issues and voter frustration. The tax was originally pitched as a way to plug a $1.8 million hole in the budget and secondarily pitched to improve public health. Also, the cash flow would have made the soda tax subjective to additional tax, which is illegal in Illinois. They also did not take into consideration that local government cannot tax transactions paid for with federal nutrition benefits, making more than 870,000 people exempt from the sugar sweetened beverage tax anyway. This caused even further outrage from the people that were paying the tax. There were highly visible boycotts. People were driving to Indiana to shop, to protest, and to avoid the tax, and there were also flooding representatives with complaints. The lasting effects of the sweetened beverage tax is that beverage prices decreased, volumes of beverages sold returned to their pre-tax amount, and overall the tax did not change the public's view on the health risks associated with sweetened beverages. The lessons that we learned from Cook County's failed attempt is that the process should be treated as a political campaign. The stated purpose of the tax was inconsistent. Local content and constraints need to be understood. There was confusion around the implication of the tax, and also social and entertainment media influence and anti-tax backlash. Some suggestions in the future for anybody trying to implement this type of tax would be to address inconsistencies between identified beliefs in scientific literature, use raised revenue to help for health initiatives, communicate transparently about the true purpose of the tax, and to generate political priority for solutions to the implementation challenges. Sorry.
Okay, so in order to summarize, sugar-sweetened beverages are for sure one of the leading sources of added sugars in the American diet. And the amount of sugar-sweetened beverages that somebody consumes, there are a lot of personal and environmental factors that do influence this. But there is no question that for whatever the reasons, the consumption of sugar-sweetened beverages contribute to the development of some of the leading chronic diseases in the United States. I talked about type 2 diabetes, right? And the fact that that then can stem into other things like cardiovascular disease and cancer. We believe that sugar-sweetened taxes offer a potential way to decrease the consumption of what we know based on research is, bad for your health, these sugar-sweetened beverages, in particular in the U.S. The revenue that we take from this can be put towards other capitals to promote public health. I mentioned earlier about education campaigns, letting people know just how bad some of these sugar-sweetened beverages are for you. We believe the implementation process should be treated as a political campaign, and the purpose should remain consistent. Research has shown that sugar-sweetened beverage taxes do effectively decrease population intake. So that in itself is a major thing. Plus, when you consider the revenue, if that were to be pushed into an education campaign, those are two major wins as far as a potential sugar-sweetened beverage tax in a particular area. And because of the growing issues with obesity and chronic disease and type 2 diabetes, metabolic syndrome, the uptick in cancers that are potentially a side effect of some of these inflammation and metabolic syndrome related things. Action should be and needs to be taken to decrease the consumption of sugar sweetened beverages in the United States. And we believe that a beverage tax is one way to help do that.
Based on our research done on this topic, our position on the issue is that sugar-sweetened beverage taxes may be a means to promote improved population health through lowered added sugar intake. Our call to action is to implement a sugar-sweetened beverage tax on the campus of Eastern Illinois University. We can do this by first determining if there's a need for the sugar-sweetened beverage tax, then advocating for healthier beverage options on campus, and spreading awareness on campus and through social media. We can also do this by leading by example, because ultimately supply will meet demand. Thank you for listening to our presentation.